Chronic pelvic pain. You know, for so many women, it's this frustrating long-term mystery that just doesn't seem to have any clear answers. It's actually a huge reason for visits to the gynecologist, but way too often a specific cause just can't be found. It leaves everyone just searching for clues.
But what if a major cause has been hiding in plain sight this whole time? Just, misunderstood and frequently overlooked. That's what we're going to dig into today.
And the first clue in our investigation is this number right here, 30%. Believe me, it represents a huge piece of this unsolved puzzle.
So, research suggests that for up to 30% of women who are dealing with unexplained chronic pelvic pain, the real culprit is the same widely underdiagnosed condition. And today, we're going to put a name to it.
Okay, so let's meet our main suspect. It's called Pelvic Congestion Syndrome, or you'll hear it called PCS. So at its very core, PCS is a vascular issue. We're talking about veins. It's defined as chronic pelvic pain that sticks around for more than 6 months, and it's caused when the veins in the pelvis just aren't working the way they should. This leads to something kind of like varicose veins, but deep inside the pelvis.
The problem lies right here, with these ovarian and internal iliac veins. See, when blood flow gets blocked, or worse, flows backward, that's a condition called reflux, pressure starts to build up, and that causes all this congestion and, well, pain.
Honestly, the easiest way to picture this whole thing is to think of a traffic jam. Your veins have these tiny little one-way gates, or valves, and their job is to keep blood moving up toward the heart. Well, in PCS, these gates are faulty, so blood starts to pool, the veins swell up, and that congestion is what causes the pain.
And get this is not some brand new discovery. The condition was actually first described way back in 1857. And yet, even today, it's still a major but often missed piece of the chronic pain puzzle for so many women. Every good investigation needs evidence, right? So let's start gathering the clues by looking at the telltale signs and symptoms of PCS. The number one piece of evidence is the pain itself, and how it's described is a really key clue. It's not usually sharp or stabbing. Instead, it's more of a persistent, heavy, dull ache. This feeling of fullness or pressure, that's a classic sign. And that dull ache is really just the beginning. The clinical picture includes this whole cluster of signs, everything from painful intercourse and periods to just feeling tired all the time. I mean, looking at this list, you can see right away how these symptoms could easily point a doctor in a totally different direction.
Okay, so this is a crucial point. It's all about understanding the pattern of the pain. This is where the whole vascular nature of PCS really shows itself. The pain often gets worse after you've been standing or sitting for a long time because, gravity makes that venous traffic jam even worse. It also tends to get worse during pregnancy when all that increased blood volume and hormonal changes put extra stress on those already weak veins. This pattern is a huge, huge diagnostic clue.
And the investigation doesn't stop there. Other clues can pop up in places that seem totally unrelated. Things like lower back pain, symptoms that feel a lot like irritable bowel syndrome, and even bladder issues. Sometimes you can even see visible varicose veins on the vulva, buttocks, or thighs, as all that pressure tries to find other ways to escape.
So if all these clues exist, why is PCS considered such a complicated case? I mean, why is it so frequently missed? Well, it's because the symptoms create this lineup of usual suspects. They overlap almost perfectly with really well-known conditions like endometriosis, IBS, and pelvic floor tension. And that sends doctors and patients down completely different diagnostic paths.
And the result of all that confusion? 4 years. According to one study, that's the average time it can take from when someone first shows up with symptoms to when they finally get an accurate diagnosis of PCS. That is an incredibly long time to live with pain you can't explain.
So the case goes cold because the clues just point in too many directions at once. The symptoms are so nonspecific that the real underlying cause, that venous traffic jam we talked about, gets completely overlooked. So how do we finally crack the case? It actually starts with one simple but really powerful tool: awareness.
And don't just take my word for it. This quote comes directly from researchers in the field. They are making a direct appeal for both patients and clinicians to become more aware of PCS. Greater understanding is the absolute critical first step to getting a faster diagnosis and, of course, better treatment.
Ultimately, knowing these telltale signs, recognizing that unique pattern of a dull, heavy ache that gets worse with standing or at the end of the day, that empowers you.
It empowers you to start an informed conversation with your doctor. You can actually provide the key evidence they might need to finally consider a vascular cause.
Which leaves us with a final thought. For the countless women out there navigating this frustrating maze of chronic pelvic pain, could simply knowing these signs, understanding this pattern, be the key that finally unlocks a diagnosis and opens the door to getting relief? It's a really powerful piece of the puzzle to think